I want to start with the debate last night between Andrew Gillum, Democratic nominee for Florida governor, and Ron DeSantis, the Trump mini-me that's running for governor. I've already been attacked on Twitter today as trying to help Ron DeSantis get elected in Florida by daring to criticize Andrew Gillum. So before I even get to it, let me put down as a very clear disclaimer. Let me put down as a very, very clear disclaimer, okay? And then we're going to get to it, because I think you could do two things at once. Number one, I don't live in Florida, okay? So I don't know Florida's issues as well as people that live in Florida. That's number one. Number two, if I lived in Florida, to be clear, if I lived in Florida, I would vote for Andrew Gillum, regardless of my reservations. Me covering Andrew Gillum and pointing out inconsistencies or moonwalking of his record is not to try and elect Ron DeSantis. Ron DeSantis is worse. Ron DeSantis is way worse. Andrew Gillum would be significantly better than Ron DeSantis. So if you live in Florida, I don't tell people how to vote. I just tell you how I would vote. Okay? You vote for whoever you want. I think Andrew Gillum is better than Ron DeSantis. And I still think, Jermaine, how could you still vote for him? I don't get it. Well, I'll explain. I believe a national election is different than a state election. I do not believe in voting for the lesser of two evils on a national level. On a state level, I think it's a little different. And I'm going to get to why after I show these clips. However, I think what Andrew Gillum did last night in the debate, I don't know if it necessarily helped him that much. Because, unfortunately, it seems he has been listening to centrist Democrats and consultants. And basically what those consultants and centrist Democrats are telling him, you have to run as far, far away from the progressive policies you pushed in the primary. The progressive policies that helped him probably one of the bigger upsets this year, him winning the nomination. So I want to play you two clips. This is not Andrew Gillum in the debate, the first one I'm going to play you. This is Andrew Gillum in early September on CNN. Listen to Andrew Gillum in early September on CNN.
Yeah, I know you have experiences,
Sure.
and you're coming from a real place, a personal place in supporting this. But as a government official, you have to make it work, and you have to make the numbers work. So I still don't understand how you would do it without raising taxes.
So the first step we would take is expand Medicaid and pull down about $6 billion a year from the federal government. That's important. Secondly, as governor of the state of Florida, I would work to bring a number of the largest states into a conversation around how it is together we might be able to negotiate prices and access to health care to cover more people and ensure that even those of us who are insured, who are right now paying premium increases year over year over year, all because Ron DeSantis and Donald Trump have worked overtime to make access to health care less affordable.
Will you say that you will not support raising taxes to make your health care plan work?
I will absolutely not raise taxes on everyday working Floridians to give access to additional
What about wealthier people?
So what I said, and I ran on this, by the way, is that we will increase taxes for corporations in our state who right now, just so you're aware, only 3% of companies in the state of Florida pay the corporate tax rate, 3%. And that 3% under the Donald Trump tax scam got a windfall of $6.3 billion overnight due to the tax reform that took place in Washington, D.C. We're not asking for all of it. We simply said we believe that we ought to bring $1 billion of that money back into the state's government because being a cheap date state has not worked for the state of Florida. And unfortunately, we've got to do that if we're going to be a leading state.
One more issue. We spent a lot of time, understandably, on health care and immigration. You have joined growing calls.
If you heard that, he said, I'll rewind it one more time.
As governor of the state of Florida, I would work to bring a number of the largest states into a conversation around how it is together we might be able to negotiate prices and access to health care to cover more people and ensure that even those of us who are insured, who are right now paying premium increases year over year over year, all because Ron DeSantis and Donald Trump have worked overtime to make access to...
In that interview, even that interview, he started walking away from Medicare for all. He started talking about pooling other states together to negotiate prices to cover more people. So that's far different than Medicare for All, where in the primary elections, he was very clearly saying we would have a state Medicare for All system if he was governor. So in that interview, he already was moving away from Medicare for All. Okay? So you have during the primary, Medicare for All for everyone in Florida. You have, and he won on that message. You have in that interview in September, we're going to negotiate. We're going to work together with other states to negotiate and cover more people. That's not Medicare for All. So it has moved from Medicare for All, which he won on, to we're going to negotiate with other states to try and cover more people, to last night. Here's last night.
I'd like to turn to health care, if I could, Mayor Gillum. You'd like to insure all Floridians through Medicare, not just those over the age of 65. Congressman DeSantis says you have a, quote, far-left socialist platform. Why is he wrong?
Well, he's wrong because he's wrong, but he's been wrong a long time. Here in the state of Florida, I am in favor, and I know Tom Lee is here in the audience. He was a member of the Senate that helped to pass Medicaid expansion in this state by 39-1 in the Florida Senate under Republican control, an effort that my opponent opposes. If we expand Medicaid here in the state of Florida, we will extend access to health care for over 800,000 of the most medically needy Floridians. 800,000. And by doing so, we'll be able to pull down $6 billion from the federal government that right now is being given away to other states because we philosophically disagree with getting folks access to health care. There are hospitals who want this. There are doctors. There are nurses associations. We can build Florida's economy simply by extending access to health care. And guess what? It's not only good for those 800,000 people who will get access. It's also good for folks like me and for small businesses who right now can't afford to get access to health care because, quite frankly, it's too expensive and out of reach. We're completely in bounds with what are the concerns of everyday Floridians, which is why when I win this race, we're going to work diligently to expand Medicaid for over 800,000 people.
So here's what people need to know. Andrew's for this concept Medicare for All, which is a euphemism. Because if you read it, it actually abolishes Medicare for seniors. It abolishes Medicare Advantage. It abolishes TRICARE. And as a veteran, I know that military families depend on it. If you get your insurance through your employer, it abolishes that. And it dumps all those people against their will, regardless of if they want to stay in their current plans, it dumps them on a single-payer government system. Taxes will go through the roof. We'll obviously face fiscal difficulties. It will hemorrhage money, and then the government will choose who gets the care and who doesn't. Floridians should have their care protected. Seniors should be able to stay with Medicare Advantage. They should be able to stay with Medicare. If you get it through your employer, you should be able to keep it.
Well, again, and I expect we'll hear a lot of this revisionist commentary and history this evening from Mr. DeSantis. But in fact, what we're proposing to do is to take $6 billion of money that ought to be coming to the state of Florida and to bring that money here to the state. Listen, there are Democrats and Republicans, folks on both sides of the aisle, who believe that this is the right thing to do. Mr. DeSantis, while in Congress, voted to discriminate.
So I'm going to continue that. But I want to be clear. What he is talking about, and more importantly, what he's not talking about, is Medicaid expansion. He's not talking about Medicare for All. So look at the evolution of Andrew Gillum. You have gone from winning the primary in Florida, saying you're going to have a statewide Medicare for All system. Then on CNN, he says, we're going to talk to other states and try and negotiate prices to cover more people. Then in the debate, and it gets worse, you're about to see it gets worse, he talks about expanding Medicaid for 800,000 people, which, by the way, I think is a great thing. That should come first before even working to push Medicare for All. Like he said, the federal government had been offering I think he said $6 billion or $6 million. I'd have to go back to states. Florida's Rick Scott, being a ludicrous extremist Republican, said no. So 800,000 of the most vulnerable people couldn't get health care. So I'm all for what he's talking about. However, what he's talking about is Obamacare. And what he's not talking about, or what he has moonwalked away from, is Medicare for all. Let's continue.
Discriminate and allow insurance companies to discriminate against people based off of pre-existing conditions. If you're a cancer patient, if you have diabetes, if you are a pregnant woman in the state of Florida, that is a pre-existing condition. It's disqualifying.
Congressman DeSantis, you voted for the Republican health care plan in the House, which would have stripped Obamacare's protections for people with pre-existing conditions. Do you believe insurance companies should be allowed to charge more to people who have pre-existing conditions?
Pre-existing conditions should be covered in that bill. They were required to be covered. It just gave states the ability to be able to do that in a way that would lower premiums for other people. Here's what I would say as governor. If somebody somehow falls through the cracks.
By the way, just on DeSantis, and I'm going to get to why DeSantis is so terrible too. Do you notice when he lies, if you watch the debate, when he lies, he talks really quick. So that was a lie, what he said, that the Trump health care bill and the Republican health care bill, it had pre-existing conditions in there, but it allowed states to opt out if they... Blah, blah, blah. I mean, he's lying, so he's kind of like just mumbling bunch of mumbo-jumbo nonsense. And Republicans do that very well. Trump does that very well. They speed up their talk. So you got Ron DeSantis there saying, yeah, the health care bill, it had pre-existing conditions. It just allowed states to opt out if blah, 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 blah. Back to Gillum.
If there's a change in law federally or court decision, I will sign a bill to take care of people with pre-existing conditions. We need to take care of those folks. But you know what? I know people in the military, families with people with pre-existing conditions who are on TRICARE. Andrew's running away from Medicare for All, but he ran commercials in the primary saying how he was for it. Medicare for All takes away TRICARE. It forces military families onto a single-payer government plan. So here's the thing. I want protections. I want to have a lot of things for plans, but you actually have to have access to a physician. You can't get stuck on a waiting list. Under a single-payer plan, man, that'll make the VA waiting list look like the Fast Pass at Disney World.
Mayor Gillum?
Listen, Mr. DeSantis wants to correct his record now, but for 6 years while in Congress, he voted over a dozen times to repeal the ACA. He voted to allow insurance companies to discriminate against people based off of pre-existing conditions. For those folks who are at home, if you're sitting on the couch with one other person, between the two of you, probably one of you has a pre-existing condition. And this congressman would have allowed for insurance companies to discriminate against you based off of that pre-existing condition. He told a cancer patient who wanted to know, without insurance coverage, how would they get access to health care? He said you could always go to the emergency room. Now, we disagree on a lot, but on that statement alone, Congressman DeSantis is disqualified for that.
The point was, when you talk about this coverage, what does that coverage get you? The fact is, with Medicaid expansion, people didn't have access to doctors. Most physicians do not accept new Medicaid patients. So the reality is, you have people with that card, but they are going to the hospital for primary care. I don't think that's a good thing, but that, in fact, is the reality.
Health care is the major issue on Floridians' minds. Everyday Floridians are concerned about getting sick, because if they get sick in this state, they can't go to work. If they can't go to work, they can't earn a wage. If they can't earn a wage, they can't pay their bills. And when they don't pay their bills, something gets cut off.
Thank you.
This is not, this issue is deserving of our time, because this is not something we can just walk past. This is the issue that is at the top of mind for everyday Floridians, and we deserve to hear from the congressman exactly what his health care proposal is. He's been promising one for months. Nothing has come from his office on this.
Well, look, Andrew wants to take away employer-provided coverage. He thinks it should be illegal. You support Medicare for all. Read the bill.
Define
That's what
Medicare
it does.
For all.
You ran commercials saying you supported single payer. You said you would do a single payer confederacy with New York and California. Man, our taxes will go up and then we'll send all the money to California. That's not a good health care plan for Floridians. So I want to protect people's current arrangements. Government should not force you off your plans.
And neither would I. The congressman, again, his votes have deluded him into his own definition of what health care is.
So you don't support Bernie Sanders' Medicare for all?
What I support is expanding Medicaid for over 800,000 Floridians who deserve to have access to their own doctor.
If a single payer came to your desk as governor, would you sign it or veto it?
What I would do is expand Medicaid
for over 800,000 of the most medically
needy people.
You wouldn't sign it?
I should also say this, because this is clearly fun and games for the congressman, but for me, I grew up having to wait for the free dental clinic to come through my neighborhood in order for us to get our teeth cleaned. As a child, I was accustomed to going into the emergency rooms because I thought that was the regular thing. I didn't realize you were supposed to have a doctor and have a regular relationship.
Thank you, Mr. Mayor.
This is not politics. This is real.
I want to turn to the economy. Congressman DeSantis.
This is not politics. This is real. And that's why I refuse to stand by the position that made me the nominee for the Democratic Party. Oh, God. First of all, and I'm going to answer, somebody had a question, well, why are you saying to vote for him in the first place? Number one, I want to be very clear. I don't tell people how to vote. So I want to make a few things clear. Number one, Andrew Gillum is very obviously taking advice from Democratic Party consultants, from Democratic Party politicians, and centrist people. He's also probably listened to pollsters who are telling him he can't run on Medicare for all. And that's why he is moonwalking faster than Michael Jackson. So there's two problems with that. And I'm sorry to say, and you could attack me if you want for the centrist Dems and some people, but that is an act of political cowardice. What we just saw was political cowardice. Okay? So that's number one. Number two, everything Ron DeSantis just said, it would be so easy. And frankly, Bernie Sanders, the reason he's so popular is because he's very easily able to articulate the truth because he stands for his convictions. Andrew Gillum could have easily said, well, if all the things you're saying are true, why is it that a new poll has 52% of Republicans support Medicare for all? Last time I checked, Ron DeSantis, across this debate stage from him, is the Republican nominee. Well, the majority of his base supports Medicare for all. So why is it that Andrew Gillum could have said, first of all, we would not raise taxes on middle-class Floridians to pay for single-payer. We would raise taxes on corporations to pay for single-payer health care, along with actually investing in education. Down the road, yes, we might have to raise taxes slightly on middle-class workers, but they would come out ahead because they would have zero deductibles, zero coinsurance, and zero copays, which Bernie Sanders articulated. Bernie Sanders has articulated this, and guess what? Medicare for all, shocker, has become more popular. Medicare for all has gotten to 70% approval among all Americans, 85% among the Democratic Party, and 52% among Republicans. So, devil's advocate, you might want to say, well, that's nationwide, Jordan. In Florida, that's different. Well, tell me what's so different. You have seniors in Florida who have Medicare. Nothing would be changed for them. You have a lot of young people. Florida has some of the most colleges in the country. They're pretty for Medicare for all. And you have, generally speaking, Florida is a swing state. So you have a mix of Republicans and Democrats, but Democrats have won. Obama won Florida twice. And if you look at Florida, health care is one of the biggest, most important topics and issues that is polled for this governor's race. So you're telling me Andrew Gillum, A, can't stand by his convictions and say, yes, I would, if elected governor, push and try and pass a Medicare for all system, and here's why. It would be cheaper for everyday people. It would cover all Floridians. It also would, dare I say, stimulate the economy, because if people have more money in their pockets, not going to deductibles, co-insurance, all medications, all these things, they could actually put it back in the economy. And I'm following the will of the people because I'm here to represent the people. 70% of Americans want Medicare for all. 52% of your party, Ron DeSantis, want Medicare for all. And then attack him for in that Republican bill, he voted to repeal it. But Andrew Gillum just let him lie and say, oh, no, the Trump bill had Medicare for all. It was just, the Trump bill had pre-existing conditions. It just was, written in origami. I don't understand, other than Andrew Gillum is doing what Bill Clinton did. I mean, if you remember, Bill Clinton in the 1990s, and frankly, Barack Obama in 2008, ran a very, very progressive campaign in the primary and then sprinted towards the middle. The problem with that is then we're told, well, you have to vote for him anyway because look who he's running against. And then you got a president or a governor or a senator or whatever that ends up giving you crumbs. Ends up giving you crumbs.